the knee is going to have to compensate by becoming more mobile and losing its stability. So 3 different assessments that we could do. And step number 2 is in the books. So let's discuss what to do if a patient comes to you presenting with knee pain. If somebody has pain at the knee and they didn't directly cause trauma to the knee, we want to take a look at the ankle and the hip. Again, the knee is designed for stability. The ankle and hip are designed for mobility. So if you have knee pain and you end up losing either mobility at the ankle or at the hip, the knee is going to have to compensate by becoming more mobile and losing its stability. So 3 different assessments that we could do at the ankle to assess for ankle mobility is going to be the knee to wall test. If you don't do the knee to wall test, you could also do this without any equipment whatsoever. But for the knee to wall, what you would have the patient do is have them place their foot toward the wall, and then you would want to have them just move as back as they can and see how far they can get their knee to touch the wall without allowing the calcaneus or the heel to lift up off the ground. If you don't want to do the knee to wall test, you could also do just the basic ankle mobility drill. And for the basic ankle mobility drill, you would have the patient go toes in line with the calcaneus, and then you want them to squat down and drive that knee as far forward as possible. And you want to see from the side, does the patella pass the medial malleolus of the opposite ankle? If they are able to pass the medial malleolus of the ankle, then they have good knee mobility. Ideally, with regard to dorsiflexion, you should be able to see 10 to 20 degrees of dorsiflexion, and that's going to be optimal. So if they can cross the patella past the medial malleolus, they're definitely going to be within range of having adequate mobility at the knee. The next thing that we want to do is assess for stability at the actual knee itself. For testing for stability, that was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.